Let me bring in my guest right now, because I need them to weigh in on this. And Busta, if you are watching this video, I want you to hear. This is Dr. Christy McDowell. She is a microbiologist and CEO and founder of Baby Scientist, Inc. She is not a rapper. She is a microbiologist, a trained scientist who went to school, and the bars that she is about to drop, Busta, deals with science and COVID. We'll also join Busta by Dr. Joseph L. Graves Jr., professor of biological sciences at North Carolina A&T University. The bars that he is going to drop, Busta, will explain to you the Delta variant and why masks matter in stopping the transmission. And then we have Dr. Alexia Gaffney, MD, an infectious disease specialist, who, Busta, is going to drop some bars to explain to you, somebody who had breathing difficulties, what it's like when you get COVID and what it does to your precious lungs that was your God-given freedom that God gave to you when you were born. So let me start first with you, Dr. McDowell. When you hear entertainers who have become Google physicians make statements like this publicly, that then spreads across the world, explain why it makes your job harder in trying to convince folks not to play games with COVID.
Good evening, Roland. Thanks for having me. You know, it angers me as well, and it vexes my soul when I hear entertainers and other people who have mass followings say ignorant things such as Busta Rhymes. And I was telling my students today about wearing a mask and getting vaccinated. Think about it. You know, I'm not a gambler, but when I do go to the casino and I lose a little money, I'm upset, $20, $40. But think about it. If you don't get the vaccine, you're gambling with your life. There's no way to leave with a tear and sad, and maybe you can borrow some money, but you cannot borrow another life. Okay? And masks protect you from spreading it as well as getting it from someone else. And Busta said, COVID can suck his genitalia. Well, let me tell you what's going to suck something if you don't get the vaccine. That virus. It's going to suck the oxygen out of your body to the point where the cells in your lungs are destroyed. You won't have the amount of oxygen that your body needs to oxygenate your blood, which in turn oxygenates your other organs in your body, which in turn allows you to live. So if you don't have the oxygen to oxygenate your blood and your organs, what's going to happen? They will eventually shut down. And I read today, one of the doctors from Alabama, she got real candid with the people. She said, if you get on the ventilator, you won't come off. I mean, it's as real as it gets. You're gambling with your life. You want to live, you want to die. You make the choice. It's that crucial. It's that crucial. And it really angers me when I hear these Google scientists out here spitting this verbiage that is not correct. And like I told my students today, stay in your lane. If your lane is rapping, be the best rapper. If your lane is science, stay in the lane of science. But don't be out here trying to do the job of someone else that you are not educated to do. And that's what I want to impart.
I want to go to Dr. I want to go back to Joseph Graves. Dr. Graves, we've had you on since last year. And you explained to people last year that if they did not wear masks, did not social distance, did not get vaccinated, that we are going to see these variants take place. And then you said if they continue to do it, it's going to get deadlier and deadlier and deadlier. And so when you, what would you say to Busta Rhymes after listening to what he articulated that has now gotten millions of views across this country?
Roland, it's one thing to do stupid things that put your own life at risk. And certainly, I don't have the right to tell Busta Rhymes how to live. It is an entirely another thing when you take a public platform and you use your celebrity to get up there to tell other people that it's okay in the middle of the deadliest pandemic since 1918. Those people who die because they listened to his video are going to be on his soul. And he's going to have to answer to God for his actions, the things that he said in public, the irresponsible behavior. And one thing I wanted to say, so people understand just how dangerous COVID is. I was in a very high-level meeting at noon today where scientists that I know and respect were calculating how many virus particles it takes to establish a COVID infection in an individual. Turns out it takes only 3. Now, why does wearing a mask help? Because it reduces the number of viruses that get to you. The more viruses that get to you, the higher the likelihood that at least 3 of them can end up establishing an infection in your body. So people who think that they can go around and they can ignore the safety precautions, they're doing just as the last speaker described. They are gambling with their lives and the lives of their loved ones and even people they don't know. And that's not freedom, that's a license. And you do not have a license to take other people's lives because of your own stupidity.
Dr. Gaffney, we are seeing, and we have seen, how black people have been adversely impacted by COVID-19. In a moment, I'm going to talk to Butch Graves, CEO of Black Enterprise. The federal government has failed to ensure that adequate dollars are coming to black-owned media for us to be able to educate our people. Talk about what we have witnessed from the beginning of COVID and how black people have been more adversely impacted by COVID than anybody else.
Yeah, so Black people entering into American healthcare systems are more likely to receive disparate healthcare than our white counterparts. We are more likely to be taken care of in healthcare systems that are underfunded, under-resourced, don't have access to experimental therapies, which, you know, for anybody who does not yet know, when you enter into a hospital setting for COVID-19 infection, the therapies that you get are considered experimental. They're emergency use authorized, right? So for everybody who's running around screaming they're not getting a vaccination because the vaccine's not FDA approved or because the vaccines are experimental and they don't want to get experimented on, you know, it's the same guidance that we have for the treatments that we're using for COVID-19 infection. So let's just get that out of the way. we as a people, we're more likely to be overweight or obese for cultural reasons, for socioeconomic reasons, because of living in food deserts and things like that. We are more likely to have the comorbid conditions that increase our risk to be hospitalized and to die of COVID-19. High blood pressure, diabetes, asthma. We live in areas of the country where the air quality is poorer, and that has contributed to adverse outcomes from COVID-19. So while our white counterparts were in hospitals where when they went on the ventilator and died at rates of 15 and 20% on the high end, when Black folks and brown folks and indigenous folks went into the hospital in the earliest parts of the COVID-19 pandemic, they died at rates as high as 88%. Okay. And so I say it all the time. I use me as an example. I, as a woman in a Black body, have zero interest in getting infected with COVID-19, going in the hospital and expecting the people there who are going to give me biased care, who's going to give me disparate care, who may not fight like hell to keep my Black ass alive. I'm not placing myself in their hands and hoping that I come out on the other side of it alive. You know, I've seen what it looks like for someone who's hospitalized on a ventilator for 30 days, 60 days, 90 days, things that we would never, ever consider doing in the past to keep somebody alive, and they come out paralyzed, they come out with loss of organ functions, come out with, cognitive dysfunction, inability to think, inability to breathe on oxygen, inability to work. And yet we will go out into the world and, jump outside of our lanes, as was said, speak about things we have no idea about, and not respect the consequences of these decisions and these lies that we're spreading. Black folks cannot afford to be a part of this whole anti-vax conversation and this anti-mask BS. We want cake, we want ice cream, we want sprinkles, we want whipped cream, we want a cherry on top. And the reality is we can't have all of that. Under the best of circumstances, we're still going to die more than our white counterparts. So we have to do everything possible to protect ourselves. So if you don't want to wear a mask, maybe you should stay home. If you don't want to get a vaccine, then maybe you should keep a mask on and stay home. But we can't be in a position where we're telling people, don't wear a mask, come out, be in the crowd, eat at the restaurant, smile at the cute chick, and spread some COVID virus and not worry about the consequences. Because running around with no mask, unvaccinated, doing what we want to do is the equivalent of putting a blindfold on, taking a loaded gun and just aiming. And at some point, you're just going to hit somebody. And we have, like you said, we have to live with the consequences of the things that we said. We have to live with the consequences of our actions. And the stakes are incredibly high. Life is on the line, and Black folks and brown folks and indigenous folks are going to be more disproportionately impacted by this in the short term and in the long term. And then we're kidding ourselves if we think we can play the same games that our privileged counterparts get to play. We just can't.
Folks, this is if y'all see my iPad, go ahead and go to it. Kelly Reinke posted this today. This is what she said. On the left, fitness coach Bill Phillips pre-COVID. On the right, 70 pounds lighter, barely surviving COVID-19 after deciding not to get the vaccine. He's getting discharged from St. Anthony Hospital on Wednesday with a new outlook on life and the shot. This is how he looked before COVID and how he looked on the right after COVID. That right there explains what we're dealing with. He lived, but trust me, he is not going to have the same quality of life that he had before. I want to thank our 3 doctors and scientists for coming on. I want it, and we're going to keep doing this, because what I am not going to do is I am not going to cede any ground to Busta Rhymes, to Tank, to anybody else who puts stuff out there. Sure, you may not have millions who watch this show and who watch this video, but there's no way in hell I'm going to be given a platform and not use it for the good of Black people and allow this nonsense. And to young Black people who listen to rappers, y'all better understand, if your ass gets sick and die from COVID, Busta Rhymes will not be paying your funeral bills.
That's right. That's right.
Folks,
Can
I
say
appreciate it.
another
Thanks a
thing?
lot.
Thank
Yes,
you.
go ahead. Go ahead.
I just want to
Go ahead.
encourage all of the people. If you do get sick and you find yourself in the hospital, please ask for the drug remdesivir, the monoclonal antibody. Ask for an infusion of that drug. They don't give it to people that look like us. And I had a friend who I told to ask for it, and the nurse was really surprised that she knew about it. And she's like, "How did you know about it?" She said, "Because I have a friend that's a scientist." So I want everyone else out there, if you have a loved one who is sick, tell them to ask for that monoclonal antibody infusion. It will save their life.
All right, folks. Again, I appreciate it. Thank you for your expertise and your knowledge. And that's why we're going to keep putting, again, our black experts out here so our people can hear from actual experts. We appreciate it. Thanks a lot. Folks, back to our Roland Martin Unfiltered video in just one moment. All right, folks, if you want to, get a couple of the products of Seek.com, black-owned company founded by Mary Spio. They have these amazing 360-degree headphones, tremendous sound. The bass is incredible. And so they also have their virtual reality headsets. You place your phone into it. You can see the VR content at Seek.com, Seek.com, or you can watch 360-degree videos. All you got to do is go to Seek.com, use the promo code RMVIP21, RMVIP21, where you can actually get those products. And then when you purchase one of them, or both, those portion of the proceeds comes back to us here at Roland Martin Unfiltered. So we certainly thank Mary Spio and Seek for being a partner with us here at Roland Martin Unfiltered.